Hey guys, welcome to Man Medicine, where we talk about how men can optimize their health and escape the collapsing U.S. healthcare system. Today, we're going to talk a little bit about natto and specifically nattokinase, which is a supplement that gets used in the alternative medicine world for a number of different reasons. It's a purported blood thinner. It might have some cardiovascular disease benefits, might have some effects on cholesterol and blood pressure. So you'll see it used for all sorts of different things. And I thought about this talk because I actually had a patient that came in the emergency department who was on nattokinase, and it prompted me to do a little bit of research on it. It wasn't a visit related to a complication from the nattokinase; it was just something that they happened to be on. So, nattokinase it comes from natto. It's a traditional Japanese dish of fermented soybeans, and the soybeans are fermented with a bacteria called Bacillus subtilis, and the bacillus species that we're talking about here is it's actually quite benign. It's not known to cause any diseases or generally cause any problems, especially in an immunocompetent host. Unlike some other species of bacillus out there, like the anthrax bacteria, which is also a member of the bacillus species. So this particular bacillus species, however, is ubiquitous. It's found in the human gut. It's found in the gut of like ruminant animals. It's in the soil. And like I said, it doesn't really cause any particular problems. It's actually heavily used in research for a number of different reasons. Both E. coli and this particular bacillus, Bacillus subtilis, is used in the research world quite a lot. It's apparently a very straightforward organism, and it's amenable to use in a number of different contexts for studying bacterial genomes and a number of other different things. So interesting stuff. Natto became of some public interest when it became theorized that perhaps some of the extended lifespan or longevity that we saw in certain Japanese populations could be linked to natto consumption. There were some thoughts that there might be cardiovascular benefits there. I'm not really sold on that at this point, but it certainly remains a possibility, and it's one of the things that has caused natto and nattokinase to become more popular. So what is nattokinase? It's a serine protease, 275 amino acids long. It's actually a member of, there's a family of these proteases, these serine proteases, which all work in a roughly similar fashion that are found in nature, produced by bacteria. There's another one called lumbrokinase, which is quite similar to nattokinase. Some people say it's a bit more effective. It's not unique. It's part of a family of these serine proteases that are found throughout nature. So, what are the pharmacokinetics of this? You'll see different recommendations. Sometimes people will say you have to take nattokinase twice a day, but based on this study here, a pilot study on the serum pharmacokinetics of nattokinase in humans following a single oral dose, it seems that you probably can get away with just once a day. They gave 100 milligrams of nattokinase to healthy volunteers, and they got a peak level within about 13 hours. So it's a bit of a slow rise in serum levels. And even at 24 hours, although obviously the levels had gone down, there still was evidence of biological activity at that point. So you can probably get away with dosing this once a day. Now, the other thing I'll point out is when let's say you order a bottle of nattokinase, what you'll see on the label in terms of its units, it can vary. What you may see is just milligrams, which is obviously a weight-based unit, but what you should be interested in and how you should be dosing nattokinase is based on fibrin units, or FU. So that's a measure of the actual potency. And you'll see that with various enzyme products. They won't use necessarily milligram nomenclature, but they'll be using units of some kind. In this case, it's fibrin units, which are FUs. And so typical capsule that you can get here in North America has about 2,000 FUs per capsule. So, but look at the bottle. That's important to know because you can get fooled sometimes. You could have a product, for example, that has 400 milligrams of nattokinase, but it actually is less potent than a product that has 100 milligrams of nattokinase if you didn't also look at the FU units. And sometimes they don't always list those. If it's in a, quote, proprietary blend, then you might just have the milligram dosage, and you actually don't know how much efficacy and how much potency that particular product has because they're not listing the FUs. So if you're going to use nattokinase, you probably want to buy a supplement that lists the fibrin units, so you know exactly what you're taking. And I'll show you the different fibrin unit dosages that they used in these studies, and you can make a decision at that point. What you think the dose is appropriate for you. As always, I want to just present you guys the data when it comes to supplements, and I'm not trying to sway you one way or the other. I'm just trying to give you information so you can make a good decision for yourself. I don't sell nattokinase. I don't sell anything other than good advice. So, it's going to be up to you to decide whether this is something that you want to try on your own. Okay, let's review some of the claims of nattokinase. The first one is that it has effects on serum cholesterol, and you'll see people advocate for nattokinase as a sort of a natural statin alternative or other way to like modulate your lipid panel. And the data on that, I will tell you, is it's a bit of a mixed bag. So this is a study here from the Asian Pacific Journal of Clinical Medicine, 2008. Combined nattokinase with red yeast rice, but not nattokinase alone, has potent effects on blood lipids in human subjects with hyperlipidemia. Okay, another mouthful. So basically what they did here is for 6 months, they gave test subjects either nattokinase alone at 200 milligrams, or in this case, 7,000 FUs daily. They gave them nattokinase plus red yeast rice, which if you're interested in red yeast rice, if you want to learn a little bit more about it, I have a video in the archives on that. You can take a look at it. And at the end of the day, what they found basically is, if you took the red yeast rice with the nattokinase, yes, you did see an improvement in the lipid parameters, but that's to be expected. Red yeast rice contains a number of naturally occurring low potency statins, so you would expect to see some improvement in the lipid parameters just based on that. But when they gave these test subjects, at least at this dose of 7,000 FUs, just nattokinase, there was essentially no change, no statistical difference in triglycerides, total cholesterol, calculated LDL, or HDL were seen in this particular study. So what about blood pressure? Well, this is an interesting area to explore because there does seem to be some effect based on the limited amount of data that we have. This is an article here from Hypertension Research 2008, Effects of Nattokinase on Blood Pressure, a randomized controlled trial. And what they did here, they actually used a relatively lower dose of nattokinase that we'll see in some of these other studies. So they gave test subjects here a oral dose of 2,000 FUs per day, every day for 8 weeks. And these were in people who had established hypertension, obviously. And they actually showed an effect, statistically significant drop in both diastolic and systolic blood pressure. So in this particular study, systolic blood pressure dropped 5.55 millimeters of mercury, and they got a diastolic drop of about 2.84 milligrams of mercury. So millimeters of mercury. This is not a huge effect, but it was statistically significant. So it, certainly if you have borderline blood pressure, and if this study is to be believed, then there may be some clinical effect there. As to how it works, it seems to affect the renin-angiotensin-aldosterone system much in the same way as ACE inhibitors do. So they inhibit the angiotensin converting enzyme ACE. All right. What about atherosclerosis? This is what I'm interested in, and this is what it gets used for, or at least the purported use. You'll see in the alternative medicine world is you can take nattokinase if you have coronary artery disease, if you've had a stroke before, and it is sometimes talked about as an alternative to statins. Let's talk about that. Let's see if there's any merit to that. So this is kind of an interesting article here. It's published in Frontiers in Cardiovascular Medicine. It's relatively new. It's from 2022. And it says, the title here, Effective Management of Atherosclerosis Progress and Hyperlipidemia with Nattokinase, a clinical study with 1,062 participants. I believe this was out of China. So a couple things. I mean, this was not a randomized placebo-controlled study. It was just a retrospective trial. So we have to take that into account. Not the highest quality of evidence, but it still showed some interesting findings. So they used a higher dose than you'll see in most studies. So they used 10,800 FUs daily over the course of 12 months. Now, the other confounder here is that some of these test subjects were also taking vitamin K. Some of them were also taking low dose aspirin at 100 milligrams a day, presumably for some other medical indication. So there's some confounders there, but regardless, they had some interesting findings because in addition to looking at blood work on these people, they did serial Doppler ultrasounds of their carotid arteries, and they measured the CIMT, carotid intimal medial thickness, and they measured the width of any carotid plaque that these individuals had. So they actually measured the atherosclerotic plaque within the carotid arteries, in addition to the intimal wall thickness. And yeah, lo and behold, they actually found an effect. So let's look at we'll look at the labs first. So they looked at their cholesterol panels, and again, this was after 12 months of taking 10,800 units, FU units per day. So we had roughly a 16% drop in triglycerides, a 16% drop in total cholesterol. We had a little over an 18% decline in LDL-C and almost a 16% rise in HDL-C. So these are not huge changes, but they were statistically significant in this particular study. Now, what I thought was interesting is there did seem to be some effect when they looked at the Doppler ultrasounds of these people's carotid arteries. The intimal media thickness actually decreased by up almost 22%, 21.7, and then the carotid plaque diameter here changed by 36%, which seems a bit dramatic to me. I'm not sure if I necessarily believe that. That's a fairly impressive change, I would think, over the course of a year. But regardless, that's what they found. So what's interesting, though, and what I would have loved to see in this data, there were statistically significant changes in the lipid panel. There were changes in these serial Doppler ultrasounds that they did on these patients, but they didn't mention if there was any outcome data. And ultimately, that's what you care about. At least that's what I care about as a doctor. If I'm going to put you on a medication or an intervention or a supplement that is going to change these parameters, it's going to change your lipids. I don't really care if I change your lipids per se. I want to lower your risk of having an event, so a heart attack, a stroke, etc. And this study was not designed to look at that. So it's all well and good to lower your intimal media thickness by 21%, etc. But it's kind of meaningless if you still end up having a stroke. You know what I mean? So I would have liked to seen that to see if there was any actual outcome data. So this study did show an effect. There was a similar study that was done also that actually showed no effect. So again, this is a little bit of a gray area, and it may be, in my opinion, it's probably an issue with the dose, but we don't really know for sure. So this is a study here in Clinical Hemorrhagy and Microcirculation, published in 2021. Nattokinase Atherothrombotic Prevention Study, a randomized controlled trial. So this one actually was a randomized controlled trial. There was a placebo group. Average age was 65.3. It was a bit smaller. They didn't have 1,000 people like the previous study, but they had 265 individuals, median age of 65.3, and they did not have established coronary artery disease that they knew of. So these were like relatively healthy 65-year-olds. And they followed them out for 3 years. And but they didn't use the higher dose of nattokinase. So they gave them 2,000 FUs per day as opposed to the 10,800 from the previous study. And in this particular study, no change in lipids, no change in CIMT, no change in carotid artery stiffness. So at least at that dose, carried out for 3 years, didn't seem to make much of a difference. So, maybe it's the dose that makes the poison, so to speak. With nattokinase, again, we don't really know. We need more studies. This is something you're going to hear me say a lot on this channel because it's true. And the sad thing is we probably will never get the studies that are required to really suss out how effective nattokinase is, or in what populations or in what disease states nattokinase can be a benefit, because quite frankly, there's no money in it. Big pharma is not really incentivized to fork over millions of dollars to study nattokinase. There's not going to be any large federal grants in the near future. At least that's not very likely to help look at this either. So we're kind of on our own. We're limited with the data that we have. So you just have to do the best that you can. So at the higher dose, there did seem to be some effect in terms of lipids and in terms of changes on ultrasound of the carotid artery. At a lower dose, taken over a longer period of time, there didn't seem to be an effect. So we've got a little bit of conflicting data when it comes to atherosclerosis. Okay, what are the effects on the coagulation cascade and coagulation factors? Because that's what this stuff gets used for in the alternative medicine world. And it turns out most of the studies actually do show an effect. So this is a brief one here from Scientific Reports, where they gave a single dose of nattokinase, and then they measured a whole bunch of coagulation factors. So this is a 2015 paper. A single dose of oral nattokinase potentiates thrombolysis and anticoagulation profiles. Okay, so let's see if it lives up to the hype. So this is the coagulation cascade right here. I have probably memorized and forgotten this at least 4 or 5 different times in my career. It's obviously not that important, but something that we were tested on all the time in medical school and occasionally in residency too. There's an intrinsic pathway and extrinsic pathway. It's not that important. The darkened areas here are areas where nattokinase seems to exert its effect. So it doesn't interact and it doesn't intervene at just one point in the coagulation cascade. It seems to affect multiple different factors, and that's borne out in this study. So what they found was it actually raises TPA, which is tissue plasminogen activator. Those of you in the medical field and critical care, ER, ICU, etc., are very familiar with TPA. We do use it not infrequently for acute stroke, not hemorrhagic strokes, but thrombotic strokes. I probably give TPA in the emergency department, I don't know, probably 4 or 5 times a year for acute stroke. It's if a person comes in, there's a narrow window when you can give it, and then once they're outside of that window, it becomes unsafe and the bleeding risks are too high. So sometimes people come in and it's they're past the 4.5 hour window. But anyway, TPA is actually it's been marketed as a pharmaceutical drug, but it's a naturally occurring part of the coagulation cascade. So there is a statistically significant rise in TPA levels after taking nattokinase. Unfortunately, it's only for about 3 hours. So this is not a sustained effect. If you look at some of the other coagulation factors, so fibrinogen is decreased by about 7 to 10%. Factor 7 will go down 7 to 14%. And then factor 8 will go down 17 to 19%. And this is a good chart here that shows some of the other factors as well. So the white circles here are the placebo, and then obviously the dark circles are the subjects that got nattokinase. These are their different lab tests here. The D-dimer does rise a little bit. Fibrinogen degradation products slightly elevated here. Not a huge change in fibrinogen. The AT, which is antithrombin, is elevated. Factor 7 levels, as I mentioned, are down. And then this APTT, which is an important part. It's an important test that we measure in the emergency department and in the ICU in people that are on heparin, for example. And it's a way to measure the thinness of their blood, I guess, without being too complicated about it. And so there is a statistically significant change. But keep in mind, so statistically significant doesn't mean clinically significant. And the important thing to keep in mind with all of these changes in blood values is, yeah, they did change, but they were still within what's considered to be the normal range. So there were not major swings in any of these coagulation factors or coagulation values based off of taking nattokinase, either acutely or chronically. So it did change them, but not by a lot. not by a lot, and they all remained still within the normal range. So we have to take that into account if we're going to consider using this for any sort of medical condition. So what are the indications for using nattokinase? Well, good question. So you'll see it advocated by alternative medicine practitioners and people on the internet. If they say, hey, if you're going to go on a long car ride, if you're going to go on a long plane trip, we all know that that's a risk factor for forming clots in your legs, especially if you don't get up and try to move. So if you're going to go on a 10 or 12-hour plane ride, there are people out there that say, oh, well, you should take some nattokinase so you don't get a DVT, a deep venous thrombosis. And there's only one study that ever looked at that. So, and it did seem to have an effect. So let's review that real quick. So this is the paper here out of Angiology 2003, Prevention of Venous Thrombosis in Long Haul Flights with Flight Tabs, the Lawn Flight randomized controlled trial. And there are other lawn flight studies looking at other agents, but in this one they looked at this stuff called flight tabs, and this is what it is right here. So I had to look this up. I'd never heard of flight tabs before. So anyway, flight tabs are a proprietary blend of pycnogenol and nattokinase. Now the total dose in there of this proprietary blend is 300 milligrams. Notice how they don't list the FUs there, so you have no idea what the potency of this particular drug is. It could be 5,000 FUs, could be 2,000. We don't know. It would have been nice to know that. So what they did was they took 186 subjects who were considered to be high risk for DVT, meaning they were morbidly obese, they'd had a clot in the past, they had active cancer, they had cardiovascular disease. What else? Oh, they had bone or joint problems that would preclude them from like getting up and moving around. And they put them on a long haul flight, which they said was 7 to 8 hours. I don't know if I consider that to be a long haul flight. I've done a lot of round the world flights, and I consider a long flight to be like 12 hours, 14 hours. I've taken trips to Australia and Iraq, obviously, and Dubai and places like that. Those are long haul flights. 7 or 8 hours, I don't know if I consider that a long haul, but that's what they called it in this study. So this was a placebo-controlled study, which is, at least they did that. And it turns out that 5 people in the placebo group actually ended up getting a DVT, and 2 of them had superficial clots, so superficial thrombophlebitis. DVTs are the ones that are dangerous. Those are in the deep veins, and those are the ones that are at higher risk to propagate, for example, to go into the lungs and potentially cause a pulmonary embolism, which obviously can be fatal. Superficial clots don't tend to do that, but they can be pretty uncomfortable, can be painful, and there can be some complications from those as well, though it's way less. So, and then in the treatment group, there were no clots of any kind. So, maybe there's an effect here. I found it kind of interesting. To me, just offhand, it seems like 7 people out of 7 people spontaneously developing clots on a 7 to 8 hour flight out of a total group of 186. I don't know, that seems like a lot to me. That seems a bit higher than I would expect, even with people who are at high risk. So, I'm not sure what to make of this study. It clearly needs to be repeated with more test subjects. I would like to know what the dose of nattokinase is that they're using. There's a lot of ways to improve this study, but the odds of it happening, I think, are pretty low. I mean, this was a 2003 study, and nobody's repeated it since then. So chances are not good that we're going to get more data on that. So I'm not going to say one way or the other whether you should use this as a preventative if you feel like you're at high risk, if you're going to get on a plane ride. Based on this study, there seems to be an effect. So certainly, talk it over with your doctor, and you guys can make that decision together. Now, outside of a long haul flight, would there be any indication, in my opinion, to use nattokinase as a clot prevention intervention or clot prevention technique? So, what kind of situations am I talking about? So, like perhaps after orthopedic surgery. So, if you go and you have a knee replacement or a hip replacement, that those sorts of surgeries up the risk significantly of developing a DVT. If you, if you have like a femur fracture and you're recovering from that, obviously you're immobilized. You've got issues with venous stasis. There's trauma to the vessels there. It's Virchow's triad. So, those people are at higher risk for developing blood clots. I don't think that that's a smart move on your part. If you were to forego pharmaceutical anticoagulation, which is typically used for a short period of time after orthopedic procedures like that, and you decided to use nattokinase, you're in totally uncharted territory. And based off one of the charts I'm going to show you here in a second, I'm going to explain why I think that that's a very bad idea. But you will still see alternative medicine practitioners, chiropractors, and naturopaths recommending nattokinase instead of pharmaceutical anticoagulation after orthopedic surgery. It kind of blows my mind. I think that's incredibly dangerous. I personally would not do it. Okay, other indications. So what about treating an existing blood clot? I actually saw some guy talk about this on a forum not that long ago, where he mentioned that he developed a blood clot in his leg. I'm presuming it's a DVT, and was prescribed an oral anticoagulant, so it probably was a DVT. And he said, "I didn't want to take that. I don't trust doctors." And I'm paraphrasing here, of course. And he went and took nattokinase instead. And then he was saying everything worked out fine. It dissolved my clot. Well, no, it probably did not dissolve your clot. I think that's incredibly risky and incredibly foolhardy to do that. This is a guy clearly he didn't understand the risk that he was taking, I think, by doing that. There are data showing that in animal models and in a petri dish, when you give nattokinase, you can break up established clots. So they would go in and damage a blood vessel in a rat, like the femoral artery, for example, and they would precipitate a clot, and then they would give them high doses of nattokinase, and it seemed to break down the clot over time. But that's a far cry from, developing a spontaneous DVT, for example, or God forbid, a pulmonary embolism, and putting your life on the line and risking that with nattokinase, which has never ever been studied in that particular context. So I think that's a terrible idea, and I do not recommend that you use it to treat an established clot. The other thing that you could run into is, people that have something called atrial fibrillation, which, again, I'll refer you to one of my prior videos if you want to learn more about atrial fibrillation, especially in the context of TRT. Atrial fibrillation is a high risk condition for the development of what they call thromboembolic stroke. So development of a blood clot in the atria, which then propagates up into the brain up through the carotids, and can sometimes present with a devastating stroke. It's one of the more common causes of stroke, actually, in older people, is either known or paroxysmal AFib, which they may or may not be aware of. So depending on your other associated risk factors, and the biggest one being age, most people with atrial fibrillation, either chronic or paroxysmal, would benefit from being on an oral anticoagulant. We used to use warfarin, and now, thankfully, there's a number of other ones that work in a different mechanism. These DOACs, they're called. They're a bit safer, and you don't have to get repeated blood work all the time to make sure that you're at a therapeutic level. So those are used commonly. I mean, I prescribe them maybe on a weekly basis. It seems like I see a lot of atrial fibrillation in the emergency department these days. But there's no data at all to suggest that nattokinase would be a suitable alternative to any of those anticoagulant medications, and I think that would be extremely risky on your part to substitute nattokinase for an oral anticoagulant if you had atrial fibrillation, thinking that it's going to prevent you from having a stroke. Zero data on that. And I certainly would not do it. And then finally, the other reason that you see people on chronic blood thinners is if they've had valve replacement, so heart valve, so specifically a mechanical valve. There are these bioprosthetic valves, which are a bit different, and then there's the mechanical valves. The mechanical valves universally need some sort of oral anticoagulant. It's these vitamin K agonists, warfarin or Coumadin, and I think it would be incredibly foolhardy. That is a really high risk situation for the development of clot and stroke in the heart. It tends to accumulate around the mechanical valve. And so those patients all need to be on oral anticoagulants. And we have some case studies showing what happens if you decide to take this alternative medicine approach and not take your oral anticoagulants when you have a mechanical heart valve. So this is a case here. Where was this on? This is out of Baylor University. So consequence of patient substitution of nattokinase for warfarin after aortic valve replacement with a mechanical prosthesis. So I'll just read the highlights here for you guys. So this is a 53-year-old man admitted to the hospital with dyspnea and chest pain. 3 years earlier, his stenotic bicuspid aortic valve. So he was born with a congenital valve issue in his aortic valve called a bicuspid valve. It's supposed to have 3 leaflets on it, and there are people that are born with 2. And a lot of them, as time goes on, as they get older, that valve will start to stiffen, calcify, and narrow, and then they have a great deal of difficulty pushing blood through that stenotic valve. They get a lot of shortness of breath and exercise intolerance. They can get chest pain. They can pass out. And obviously, those are all indications. Their only real treatment for that is valve replacement. So he ended up getting what they said was a 25 millimeter St. Jude's mechanical prosthesis. All of those, like I said before, require anticoagulation with warfarin. So he went through open heart surgery. They cracked his chest, put in this mechanical valve, put him on warfarin, off he went, and he did well. Well, about a month after his surgery, he decided that he didn't want to take warfarin anymore. And he read in an alternative medicine journal, so he was a chiropractor, and he read in an alternative medical journal that nattokinase could be used as a potential alternative blood thinner. So he stopped his warfarin and went on 100 milligrams a day of nattokinase. Well, you can imagine that didn't work out very well for him. So he came in very sick with significant chest pain, shortness of breath. He had aortic insufficiency. The valve was completely clogged up with thrombus, so much so that it couldn't be treated medically. So he had to go in and get another open heart surgery. They had to take out that clotted out valve, and they replaced it with something called a top hat valve, which is a different kind of valve. And he promised that he would be a good boy and stay back on his warfarin. But there are consequences sometimes to using alternative medicine and not following your surgeon's instructions, especially when it comes to serious stuff like this, like valve replacement. And it just pays to keep an open door. Communicate with your doctor. If he clearly did not understand the risks and misinterpreted the data out there and took a risk that he shouldn't have taken. This guy's actually lucky that he survived. I'm kind of surprised that he didn't have a stroke first. He's lucky that the only thing he presented with was a clogged valve, because it could have been a lot worse for him. So the final thing I want to show you why all of this is a bad idea in terms of substituting nattokinase in serious medical issues for established pharma anticoagulants is this little chart here, and it's taken from the previous study that I showed you. But we looked at the PTT here and the INR, and as I mentioned, yeah, there were statistically significant changes with the ingestion of nattokinase. But I want to show you again, these are the actual numbers. So let's look at the PTT. So why do I mention that one? Well, the PTT is something that, back in the day, if you used to come in to the emergency department and you had a blood clot in your leg or you had a pulmonary embolism, we'd admit you to the hospital and I would put you on unfractionated heparin. And then there was a PTT value that we would check every few hours to make sure that you weren't getting too thin or not thin enough. So it's been, determined over the years that basically if we could get your APTT between 46 and 70 seconds, that seemed to be the sweet spot. That seemed to stabilize the clot, gave you the lowest chance of propagation of the clot, but also didn't have such a high bleeding risk that we had to be scared about, having you spontaneously bleed into your head or your belly or whatever. So 46 to 70 seconds, that's the target PTT to stabilize a blood clot in the majority of patients. Well, you can see nattokinase, it didn't even go above, what was the highest? 31.6. from a baseline of around 30. So minimal changes in PTT. So clearly not a good idea from that regard. Getting back to atrial fibrillation, if you're on warfarin for AFib, there's a blood test called a PT-INR, or just an INR we call it, and that's what the Coumadin Clinic follows. And you need to have an INR somewhere between 2 and 3 in order to minimize your chance of having an embolic stroke when you have atrial fibrillation. So as you can see here, nattokinase it's not even close. Okay, 1.08 was the highest INR that these guys could achieve with nattokinase. And then getting back to this aortic valve replacement, if you have a mechanical valve, a lot of times that target INR is higher. It's 2.5 to 3.5, especially if it's a mitral valve as opposed to a aortic valve, because those have a higher clotting risk. So nattokinase, it's even though it has these antithrombotic effects, they're rather small. And if you have a serious clotting issue, like if you have an established clot, if you have a mechanical valve, if you have AFib, in my opinion, it's very unlikely that nattokinase is going to thin your blood enough to lower your risk sufficiently. You're going to need a pharma medication. I'm sorry, those of you that don't like big pharma, but so please don't be like this 53-year-old chiropractor and read in an alternative medicine journal or take the advice of some random person on an internet forum and stop your anticoagulant medication and start taking natto instead, thinking that it's going to do the exact same thing and be safer and more natural, because it's not. So highly risky. Okay, so what should you do if you choose to take natto? It's totally up to you. I think generally, if you're otherwise healthy, at least from the studies that I pulled for this little talk today, there were not any significant bleeding complications in the test subjects in any of these studies that I talked about. There are case reports. There were 2 in particular that I pulled that I'll spare you the details on, but one of them was an elderly guy who had a spontaneous intracranial bleed, and the other was I think it was a 92-year-old lady who fell down, had blunt trauma to her abdomen, and bled out into her abdomen from I believe it was a hemorrhagic cyst in her liver. Now that could have happened. I mean, I see little old ladies that fall down and have major bleeding and complications all the time that are not on nattokinase. But certainly if you have nattokinase on board, even though I think the effects are rather small, if you have a serious life-threatening bleed, like bleeding in your belly, bleeding in your head, if you get in a bad car accident and lacerate your spleen, which you can certainly bleed to death from that. I mean, do you want to have nattokinase on board? I don't know that I would. Certainly, if you're involved in contact sports, if you're in MMA, Muay Thai, anything where you're going to take a blow to the head, I would strongly advise against taking nattokinase. I think the risks are just not worth it at that point. Now, what about the blood pressure effects? I mean, yeah, if you want to see if it works for you, I don't think that would be a major issue. But keep in mind, remember, it acts like an ACE inhibitor. So you do not want to combine ACE inhibitors with ARBs. And what's one of the more popular ARBs? Telmisartan, right? So you guys that are on TRT, you take telmisartan. Somebody suggests that you throw in a little nattokinase to lower your risk. Well, now you've blocked the renin-angiotensin system at 2 different areas, and that's generally a very bad idea. There's only a very few rare cases where you'll ever see, and it's typically in the nephrology world, somebody on both an ACE inhibitor and an ARB. That's generally a no-no, and for good reason. So if you're on telmisartan or you're on another ARB, or if you're on an ACE inhibitor, just keep in mind that you're adding in another ACE inhibitor to that, and that could cause some serious problems, not just with blood pressure, but potentially with potassium levels as well. So we just don't know. So I would just say, if you decide to take natto, especially at the higher doses that they talked about in some of the studies, like 10,000 FUs and above, certainly I think it would be wise to periodically get blood work, check your coagulation factors. You can get a PT-INR, PTT, you can get a bleeding time. Your doctor, those are all like very standard inexpensive tests that your doctor can order for you, and you can just make sure that nothing crazy is happening in terms of your coagulation factors, which again, based on the studies I've seen, I just don't really see that happening. But regardless, work with your doctor on this stuff if you're going to take natto. There's a lot of people take supplements kind of willy-nilly and don't appreciate the fact that many of these drugs do have significant potential for adverse effects, especially if they're combined in other scenarios, especially if they're combined with other supplements or other pharma drugs, et cetera. So just be careful out there. As you guys know on this channel, I'm big on cardiovascular disease prevention. I think it's the number one killer of men and women worldwide. So obviously I take it very seriously. I treat a lot of cardiovascular disease in my hospital practice. I don't think natto has a place at this point based on the data here. And trust me, I'm looking for anything that would help. I'm not seeing enough data from the literature that I've seen to sway me to start recommending nattokinase really for any particular medication, because we have alternatives to nattokinase that work better. But that's just my opinion only. So let me know in the comments what you guys think. So if any of you guys are taking natto, if any of you have had negative side effects from natto, but also I want to hear about the positive stuff too. Has it affected your lipids? Has it affected your blood pressure? Are there any other benefits that you've noticed that maybe I haven't mentioned or talked about here today? I would love to hear from you guys. So let me know what you think, and I will catch you all next time. Bye-bye.
All Man Medicine video and audio has been created and shared online for informational purposes only. This podcast does not constitute the practice of medicine or professional healthcare services of any kind, including the giving of medical advice. I am not your doctor. No doctor-patient relationship has been established. This content is not meant to be a substitute for professional medical advice and should not be relied upon solely for that purpose either. The only purpose of this content is to present peer-reviewed, research-backed health information for your consideration. As always, rely on the advice and guidance of your personal physician before undertaking any activity presented here, and if in doubt or not comfortable with said activity, practice discretion. Your health is your responsibility and not ours. Finally, I take conflicts of interest seriously. I accept no compensation whatsoever from any private corporations, including pharmaceutical or supplement companies. You can trust that if I recommend a medication, product, or service, it's because I genuinely believe in it and not because I'm being paid to endorse it.